Now that you've had the introductory video to the female reproductive system, I'd just like to make a few points about um, each of those parts. One of the unique things is it's a little more difficult to see the female reproductive system because it's all internal, but this picture gives you just an idea of where different things are in relationship to the external part of the reproductive system. So again, I'm just going to be talking about some external parts and some internal parts and the 12 different things that are listed here. Again, this is just a side view of the female reproductive system, and again, gives you a different perspective of the relationship where the different parts are. The first thing is that the female reproductive system is extremely protective of itself, and so there's multiple levels of protection, the first being the labia majora and the labia minora. And these are skin folds that protect the opening to the vagina. And when a woman gets sexually stimulated, the increased blood flow allows these lips to part, if you would, and makes it easier for the penis to be inserted. And then again, when a woman's not sexually stimulated anymore, the blood flow reverses, and these labia majora, labia minora become thinner and close up to protect the opening of the vagina. Again, this is try to provide you multiple views, and this is what a gynecological view of vagina would look like. At the top of the opening to the vagina is the clitoris or clitoris. Both pronunciations are correct. And it's like a little small penis in that when a woman gets sexually stimulated, blood flow increases and causes the clitoris to stick out a little bit. And if that clitoris or clitoris is stimulated by touch, it can cause an orgasm because of the number of nerve fibers that are found there. When it comes to breasts, we talk about this simply because of the not necessarily the sexual reproduction aspect of it, but the childbearing functions of a female's breasts. And breasts are primarily made up of fat. They produce milk, obviously, when a woman has a baby and allows that baby to be breastfed. That process is called lactation. Lactose is the sugar that's found in milk, and the lactiferous ducts are the small ducts that surround the nipple and create that milk when a woman, again, her body is stimulated from pregnancy and will continue to produce milk until she weans the baby off that. The vagina is a hollow muscular tube, two functions, allows a penis to be inserted so that the semen can be deposited closer and swim into the uterus, and fallopian tubes define the egg, and also the birth canal, if you will. It's when a woman has vaginal birth, the baby comes out through the vagina. All women are born, all girls are born with a protective skin covering to the internal part of the vagina called the hymen. It's one of those protective layers. And this hymen, this skin, can be torn through sexual activity, through sports, through multiple different ways. But most oftentimes when a woman loses her virginity, there's some blood present and some pain, and it's because of the tearing of this hymen. Once it's torn, it continues to stay torn, and that bleeding and that pain should subside. On each side of the opening to the vagina are two glands called the Bartholin glands. They produce a clear liquid that lubricates the vagina, allowing the penis to be inserted. The opening to the uterus is called the cervix, and in the STIs we talk about cervical cancer, and I showed you pictures of a healthy cervix and an unhealthy cervix, and this is the part of the female reproductive system that we're referring to. It stays closed when a woman is pregnant until she's ready to give birth, and then the picture on the right, you can see that when a woman is dilated, they're measuring the opening to the uterus, the cervix itself, and that's how they determine whether she's ready to give birth or not. The endometrium and the uterus. The uterus is the large part of the reproductive system that's hollow, that holds a developing baby or the developing fetus. And the endometrium is the lining of the uterus that gets built up in a woman's menstrual cycle, and it allows the egg to attach itself to the wall of the uterus, and so that it can, again, use the nutrients of the woman's body if a pregnancy has taken place. When a girl has a period, it's actually the uterus breaking off this layer of built-up lining, and the endometrium is what is shed during a woman's period. The fallopian tubes are the tubes that carry the eggs from the ovaries to the uterus. The ovaries are like the testicles in a man. They are responsible for the eggs. However, unlike in the male reproductive system where we produce sperm continuously, all young ladies are born with all the eggs in their ovaries that they'll ever need. And usually the ovaries alternate from left to right, releasing eggs during a menstrual cycle. However, sometimes they can both release at the same time, or through the use of fertilization drugs, doctors can manipulate multiple eggs to be released at one time. When it comes to the menstrual cycle, just a couple points I'd like to make. One of the things that we'll talk about is ovulation. Ovulation is the term that we use when the egg is released from the ovary. And while a normal cycle is around 28 days, the hormones estrogen, progesterone, FSH, and LH are extremely unique to an individual woman. And so while we can talk in generalities, a woman's period is really specific to her. And it can be shorter than 28 days, longer than 28 days. Ovulation doesn't always take place on the 14th day of the cycle. Women can have inconsistent periods month to month. There's just a variety of different things that may happen there. These two diagrams kind of show what happens from a hormonal perspective when a woman goes through a menstrual cycle. And you can see that on the bottom, the endometrium is built up, and it kind of gives you the days. And then the colored lines represent the different hormones and what they're responsible for in each of those time frames of a woman's period. You get a lot of questions about premenstrual syndrome and what actually PMS is. Something that is not necessarily related to every hormonal cycle. And you can read it here that symptoms of PMS are a little bit, actual PMS can be quite serious. And then here are the answers to those questions that I started at the reproductive system with, and it just again tries to give you a little bit more insight into some of the common questions that kids have.